Today, I want to talk about the posture anomalies of the individuals with different skeletal face types. Today, the image of the teeth, jaw, and the face can be examined in 3D with stereophotogrammetry, intraoral digital scanning, combined computer tomography. Studies evaluating class 1, 2, and 3 malposition in 3 dimensions with CBCT, stereophotogrammetry scanning, have obtained very important results. Class 1 anomalies may show values close to class 1 and class 3 anomalies. Morphologically, it is seen that there is a connection between the mandible and the maxilla volume in the skeletal class 2 malpositions. When skeletal anomalies are compared, both maxilla and mandible volumes are higher in class 2 and 3 short face type than long face type. Class 2 individuals have been reported to have higher mesiodistal and buccolingual tooth dimension.
Hello, Dr. Beyza. Sorry for interrupting your presentation. I could only able to see your first slide. Can you move your slides?
I'm seeing my slides. Don't you see it there?
I could only see your first slide.
I see the others, but if I do like that, is it clear for you?
Yes, doctor. Now it's in third slide.
Okay, then I'm presenting like that. Okay, I'm beginning again. Today, the images of the teeth, jaw, and the face can be examined in 3D with stereophotogrammetry, intraoral digital scanning, and combined computer tomographies. Studies evaluating class 1, 2, and 3 malpositions in 3 dimensions with CBCT, stereophotogrammetry, and the mount scanning have obtained very important results. Class 1 anomalies may show values close to class 2 and class 3 anomalies. Morphologically, it is seen that there is a connection between the mandible and the maxilla volumes in skeletal class 2 malposition. When skeletal anomalies are compared, both to maxilla and mandible volumes are higher in class 2 and 3 short face than long face type. Class 2 individuals have been reported at higher mesiodistal and buccolingual tooth dimension than class 1 and 3. In studies evaluating the mesiodistal dimension of the teeth, statistically significant differences were found in the patient with class 3 malocclusion. Soft tissue growth and development of patients with class 1, class 2, and class 3 malposition show significant differences compared to other skeletal anomalies. Dental, maxillofacial, and craniofacial structures are closely related to each other and the spine and the posture. Sachin et al. In a review, it was concluded that the prevalence of the unilateral angle class 2 malocclusion may be associated with scoliosis. In the same study, he stated that the risk of the lateral crossbite and the midline deviation increased the patients with the scoliosis. Pugere et al., Lipode et al., and Ben Bassett et al., they stated the malocclusion was observed with the higher frequency in patients with idiopathic scoliosis compared to control patients. The more common conditions among 3 malocclusion are angle class 2 malocclusions, lateral crossbite, lower midline deviation, and the facial asymmetries. For this reason, orthodontists can contribute to the early treatment of the spinal cord deformities by recommending an orthopedic consultation when they diagnose certain dentoskeletal features such as dentofacial asymmetry, which are seen with class 1 malocclusion, class 2, and class 3 malocclusion in orthodontic examination. The development of maxillofacial malocclusion gradually extends from the dentition to the skeletal jaw relationship with the dentofacial growth pattern. Orthodontists should carefully examine the patient's posture during the extraordinary examination. Lowosky et al., in a study that analyzed the relationship between the prevalence and the type of the malocclusion and the presence of the idiopathic scoliosis, it was concluded that the incidence of malocclusion in children with idiopathic scoliosis is higher than their health peers. When establishing orthodontic treatment goal, they should also pay attention to the ultimate relationship between the overall body posture and occlusion, head and neck. Silowski et al. In their study examined the relationship between malocclusion type, body posture, and nasopharyngeal obstruction in the children aged 7 to 14 years. Observed a significant relationship between the sagittal position of the mandible, so SNB angle, and the kyphiotic posture. In the same study, kyphotic posture was found to be significantly more common in the patient with nasopharyngeal obstruction. Lipode et al. In their study, in which they examined the relationship between the body posture parameters in the sagittal profile and the sagittal chin position with three-dimensional measurements, it was concluded that the mandible has a greater effect on the body posture than other craniofacial parameters. As a clinical implication of a same study, it was concluded that patients with severe malocclusions should be examined interdisciplinary before performing orthodontic surgery to minimize the postural impact on the altered jaw relationship after surgery. In the study, Beyza et al., patients with idiopathic scoliosis had more frequent features of asymmetric malocclusion compared with the random population. It has been reported that there is a significant relationship between the sagittal position of the jaws and the face type and the position of the hyoid bone and the pharyngeal airway. As Amat pointed out of one of her studies, the relationship between posture and the different face type is not a result of pure coincidence. Therefore, these two concepts can be considered as evidence of a true pathological finding, the meaning of which is just beginning to become clear. Klose defined the masticator system as follows in his published work. The masticator system is a structure consisting of the mandible, which is mobile and guided by the contraction of the masticator muscles and by two temporomandibular joints. According to systematic review of the literature by Heng et al., covering the period from the 1926 to December 2005, there are 266 published studies reporting the relationship between the masticator system and spinal disorders. According to 216 articles, there is a relationship between the masticator system and the head posture, and according to the 53 studies, there is a relationship between the pelvic tilt and the oral cavity. 121 articles conclude that occlusion affects posture, and the 171 articles claim that posture affects occlusion. Untreated stomatogenetic system disease, especially temporomandibular disorders and the malocclusions, carry a risk for development of postural disorders. Several studies show that different mandibular positions cause variation in the body posture. Commercially, changes in the body posture can also affect mandible position. A more symmetrical mandibular position also results in the more symmetrical contraction pattern of the sternocleidomastoideo muscle and provides a more balanced posture. There are also studies suggesting that its occlusion may affect body posture and spinal curvature. The findings of some studies in the literature suggest that cervical lordosis is reduced in people with long mandibles, mostly people with the skeletal tree malocclusions. In the study of Deatolo et al., the cervicospinal canal of the skeletal class 3 group was observed to be significantly flatter than that skeletal class 1 and class 2 children. This finding supports the finding of reduced cervical lordosis of spine associated with the skeletal class 3 children. Positive correlation have been reported between different craniofacial morphologies and the posture. Nobili and Adverse in their study, while observing an anteriorly displaced posture in class 2 malocclusion, they observed posteriorly displaced posture in the class 3 malocclusion. Lipot et al. In their study showed correlation between craniofacial patterns and back-shaped profiles. Patients with distal and the vertical craniofacial patterns have higher upper thoracic, lombardotic, and the pelvic angles than normal patients. As a result, mastering the characteristic of skeletal class 1, 2, and 3 malformations can cause of the early diagnosis and orthopedic problems and provide prophylactic prevention. So, thanks for your attention.